blessed day. I am Josalana Lunag, a first-year nursing student from Our Lady of Fatima University, Pampanga campus. Today, I will demonstrate a transferring a patient from bed to a chair. Transferring a patient from the bed to a chair is important because it promotes mobility, improves circulation, and enhances respiratory function. First is I will review the patient's chart to see if there are any additional activities that might be needed throughout the procedure and to check if there are any limitations within their physical activity. Okay, and right after that is I will perform a proper hand hygiene to prevent the spread of any microorganisms. And I will greet and identify the client and explain the procedure. Good day, ma'am. I am Giselle, student nurse from Our Lady of Fatima University, Pampanga campus. And for today, may I please ask for your name, your age, and your birthday?
Legisay Nona, 54 years old, August 29, 1970.
Okay, so for today, I'll be transferring you from your bed to a wheelchair. Is that okay with you, ma'am?
Okay po.
Okay, so I'll just close the curtains to provide more privacy throughout the procedure. And I will place the bed in its lowest position and elevate the head of the bed to a sitting position as tolerated. And right after that, I will ensure that the bed brakes are locked and position the chair to the bed, and I will lock the chair wheels or stabilize the chair if it doesn't have brakes. After that is I will encourage the patient to use a stand assist device if available and assist the patient toward the side of the bed where the transfer will occur. Okay, so po tayo ng konti, ma'am. Okay. After that, while maintaining the proper alignment is I will assist the patient into a sitting position on the side of the bed. Okay, so I'll just assist you in a sitting position, ma'am. 3, 2, 1. Okay. And I will assess for any dizziness, weakness, or any signs of orthostatic hypotension. And I will allow the patient to dangle the legs before proceeding. Okay, so lower your legs po, ma'am. And shake lang po natin. Okay. After that is I will apply the gait belt securely around the patient's waist according to facility policy. Okay, so lalagay lang po natin ito, ma'am. Okay, and using the gait belt and proper body mechanics is I will assist the patient into standing position while assessing balance and leg strength. If the patient becomes unstable, I will safely return the patient to the bed. Okay, so tatayin na po tayo, ma'am. 3, 2, 1. Okay, before proceeding is I will assist the patient into a seated position while maintaining support through the gait belt and proper body mechanics. So, do you feel any dizziness right now, ma'am?
Wala naman.
Okay, so ulit po tayo. Dahan-dahan po. Okay, and after the transfer, I will assess the patient's alignment, comfort, and safety. And I will remove the gait belt if appropriate and provide a blanket if needed and ensure the call bell and personal belongings are within reach. And lastly, I will clean the transfer equipment according to facility policy, remove the PPE if used, and perform a proper hand hygiene. So are you now in a comfortable position, ma'am?
Yes.
Okay. Good day. I am Josalana Nunag, a first-year nursing student, and for today, I'll be demonstrating on how to properly perform a transferring a patient from a chair to a bed. First is I will review the patient's chart to check if there are any limitations from physical activity and if there are any additional monitoring that might be needed throughout the procedure. Okay, after checking is I will perform a proper hand hygiene to prevent the spread of any microorganisms. Okay, after that is I will greet and identify the patient and explain the procedure. So good day, ma'am. I am Giselle, student nurse from Our Lady of Fatima University, Pampanga campus. And before we proceed, may I please ask for your name, your age, and your birthday?
Darisy Luna, 54 years old, August 29, 1972.
Okay, so for today, ma'am, I'll be assessing you and I'll be transferring you from your wheelchair to your bed. Is that okay with you?
Okay.
Okay, so after that is I will close the curtains to provide privacy throughout the procedure. And after providing patient's privacy, is I will place the bed in its lowest position and ensure that the bed brakes are locked. Okay, and I will position the chair close to the bed at a 45-degree angle and ensure that the chair brakes are locked if available. Okay, just checking if the chair brakes are locked. Okay, and next is I will assess the patient's level of consciousness, strength, balance, and ability to assess during the transfer. Okay, ma'am, so are you feeling well today?
Okay.
Do you feel any dizziness right now?
Wala na.
Okay. And after that, I will ensure that the patient is wearing non-skid footwear to reduce the risk of slipping and falling. Okay? And after that is I will apply the gait belt securely around the patient's waist according to facility policy. Okay, and standing directly in front of the patient is I will maintain a proper body mechanics by keeping my feet shoulder width apart and flexing my hips and knees. So, while using the gait belt and proper body mechanics is I will assist the patient into a standing position while assessing the patient's balance and tolerance to movement. Okay, so tatayo na po tayo, ma'am. 3, 2, 1. Okay. Nahihilo po ba kayo? Okay. And after that is, of course, as I will ask my patient, I will assist my patient for dizziness before proceeding. And with that is I will instruct the patient to reach for the back of the bed and slowly lower into a sitting position. Okay, so hindi po kayo umupo, ma'am. Okay? And after that is I will slowly lower into a sitting position while continue supporting the patient with the gait belt. And after the patient is seated on the edge of the bed, is I will assess for comfort, balance, and if there are any signs of dizziness. So, comfortable po ba kayo, ma'am, sa position na ganyan? Okay. And using a proper body mechanics is I will assist the patient in lifting the legs onto the bed while supporting the shoulder and the trunk as needed. So po tayo ng konti. Ask mo nga lang po yung paano. Okay. And I will position the patient comfortably in the bed with proper body alignment and I will raise the side rails if indicated. Okay. And I will remove the gait belt if it is no longer needed. And finally, I will clean any transfer equipment according to the facility policy, remove my PPE if I used, and perform proper hand hygiene. Okay, so this concludes my demonstration of transferring a patient from chair to a bed and bed to a chair.